500,000 doses of Oxford-AstraZeneca will be on Canadian soil tomorrow.
Health Canada authorizes vaccines based on the fact that they are effective.
However, the National Advisory Committee on Immunization says there just isn't enough data to determine how effective it will be for seniors. So the panel says the shot shouldn't be used in people 65 and older.
They will update as needed, but this is what they recommended at this point in time.
But Dr. Tam says it doesn't mean AstraZeneca doesn't work. Some studies show promising numbers. Since December 30th, 500,000 people in Scotland, most over 80, received the AstraZeneca vaccine. Their public health units found it reduced hospital admissions by 94%. In Canada, health officials can strategize as they have 3 vaccines in the mix.
You're going to then give your best advice as to how you best utilize them. Based on the information.
That means the pressure is now on the Ontario government to readjust the vaccine rollout strategy.
We know with respect to age that it's not recommended for people over age 64. So we're doing the calculation based on the AstraZeneca vaccine coming into the mix.
It's unclear who exactly will get the AstraZeneca shot.
One of the key ways to roll this vaccine out fast is in that younger population.
Ontario's health minister hints at where it will be used.
For mass vaccination clinics and in places where, in some of our correctional facilities, for example, ultimately.
But the opposition wants to see a plan as soon as possible.
Too many questions at this late date. Too many questions, not enough answers.
With Moderna and Pfizer shipments set to accelerate, the Ford government also wants to know whether they can extend the time period between doses of those vaccines. It's something British Columbia announced yesterday, spacing out the doses by 4 months. Ontario's Minister of Health has asked the National Advisory Committee on Immunization to look at the evidence and make a suggestion. Minister Elliott says a 4-month delay between shots would ramp up the rollout.
You can have more people be vaccinated, at least with the first dose. And with the variants of concern out there, this could make a significant difference for Ontario in reducing hospitalizations and deaths.
A study in Israel found the first dose of Pfizer is 85% effective. And UK data has shown Pfizer reduces infections by 70% after the first shot. The AstraZeneca shots that will be in the hands of health officials tomorrow, we're learning, will expire on April 2nd. And the Ontario government is set to receive anywhere from 100 to 300,000 doses of this initial shipment. And at this hour, there's still no exact plan on the rollout.